Hello, everyone, and welcome to today's session on emergency preparedness. Thank you for taking the time to listen to this short yet educational BioBrief by HandSubmit Limited. The agenda for today covers emergency preparedness in the dental office. Pay close attention so you know what to look for or which questions to ask at your dental clinic. Let me start off by telling you that life-threatening emergencies can and do occur in the practice of dentistry. They can happen to anyone, a patient, a doctor, a member of the staff, or a person who's merely accompanying a patient. A medical emergency is classified as an acute injury or illness that possesses an immediate risk to a person's life or long-term health. Emergencies may require assistance from another person, who should ideally be qualified to do so. Most emergencies require urgent intervention to prevent a worsening of the situation. Examples of medical emergencies include syncope, which is another term for fainting, allergic reactions, chest pains, and heart attacks. In spite of most meticulous protocols designed to prevent the development of life-threatening situations, emergencies will still occur. To keep patients safe, dental professionals across Canada are required to maintain their basic life support training or CPR certification. Regardless of who is experiencing the medical emergency, dental professionals are trained to handle the situation. Life-threatening emergencies are pretty infrequent, but they can still occur. Reasons why is because, the increasing number of older persons seeking dental care, therapeutic advances in the medical and pharmaceutical professionals, the growing trend towards longer dental appointments, and the increasing use and administration of drugs in dentistry. Although most situations arose while undergoing treatment, some can occur in the restroom or even in the waiting room. Remember, most causes of medical emergencies in the dental office are due to stress. We understand that treatment can be stressful. However, dental professionals are trained and they cater to those who are worried. This next session will focus on facts about medical emergencies. Syncope is the most common medical emergency due to high volumes of stress and anxiety affiliated to dental treatment. This was proven in a study conducted by Dr. Stanley Malamed. The study was done by Dr. Malamed in combination with Dr. Fast, Martin, and Ellis. With help from different dental practitioners across North America, a survey was sent out asking about medical emergencies. The results from that survey concluded that syncope calls for 50% of all medical emergencies. Dr. Malamed, a dentist and anesthesiologist, says that any time a patient goes unconscious, it's considered life-threatening and should be handled with immediate attention. Epinephrine, diphenhydramine, salbutamol, aspirin, nitroglycerin, and glucose are the main medications each emergency kit should have. But who's to say that that's enough? What if CPR is needed? A barrier? What if someone faints and doesn't wake up with glucose or oxygen therapy? Ammonia inhalants? Having extras in a medical emergency kit is ideal because not every medical emergency is the exact same. Since we learned that medical emergencies could happen to anyone at any time, all dental clinics are required to have an E-size cylinder of oxygen. Orthodontists, endodontists, periodontists, prosthodontists, surgeons, and general dentists must have oxygen. Did you know that oxygen is used in 90% of all medical emergencies? It's typically the go-to plan when someone feels unwell or feels faint. Unless it's an epinephrine auto-injector, such as an EpiPen, the dentist is the only person at the clinic legally allowed to administer medical emergency medications. The exception to this rule is a nurse or someone else who's been trained and certified to deliver medications. In the rare event that the dentist is the person in need of help, or they're just not present at the time of the medical emergency, the next person to step up should be the dental hygienist. Dentists should always review both the medical history form and medications specifically instead of asking generally if there are any changes in health. This will avoid the patient to simply say there have been no changes since last appointment. It's possible that the patient forgets that they've had changes since their last appointment. It's possible that the patient is not on the same medications they used to be on. And it's possible that they're taking new ones that could influence the outcome of the treatment. This is why the dentist should review the medical history in detail prior to starting any treatment. Next, we're going to touch on the basic medications in a medical emergency kit and what they do. Epinephrine is the most important medication in the emergency kit. Having at least 2 sources of epinephrine will have the clinic not only compliant, but will keep the patient safe and confident. Diphenhydramine is injectable Benadryl. It's used to prevent a life-threatening allergic reaction from reoccurring. Salbutamol is used on patients experiencing an asthmatic attack. This medication will open up the bronchioles in the lungs, giving the patient better airways. Nitroglycerin comes in a pump spray and is used to treat patients with a sudden onset of chest pain. Glucose is used when a patient feels faint, either from not eating or just simple nerves from being at the dental clinic. Glucose will raise the blood sugar levels, hopefully preventing the patient from fainting. Aspirin is used to treat patients suspected of having a heart attack. The doctor is to give the patient 2 to 4 tablets depending on the severity of the heart attack. It's best to give the patient non-enteric-coated aspirin because it will be absorbed quickly by the body. Since HandsomMed's team understands firsthand what it's like to work in a busy dental practice, we've taken on the responsibility of tracking, monitoring, and replenishing those 6 key medications. This service is called automatic replenishment, and we offer it free of charge. The only business is on the medications themselves, but there is no charge for the tracking and monitoring service. HandsomMed is a Canadian dental pharmaceutical company. We're always producing solutions to better the lives of dental patients. Being the only company in the Canadian dental market to sell medical emergency kits, we have an entire team dedicated to this product. We have a large percentage of Canadian dentists who believe that Lighthouse is the best option when it comes to emergency kits. Is your clinic as concerned for patient safety as we are? Our monitoring system is what makes our Lighthouse kit so unique. Automatic replenishment is ideal for all clinics because it allows more time for patient focus. There are 3 components that make up automatic replenishment. The first part of our automatic replenishment program is tracking, which is done internally. We know where the medications are at all times, while in travel or not. Our system automatically reminds us when it's time to send out new medications and also confirms where the new medications are going. This relieves a dental professional from the clinic to have to do it themselves. Monitoring is the second benefit of the automatic replenishment program. HandsomMed automatically monitors expiration dates of medications and monitors manufacturer recalls. This allows for more patient focus and instills confidence that their medical emergency medications are always current. The final component to automatic replenishment is the replenishing part. We deliver the medications directly to the clinic, so their only job is to remove the old medications and add in the new medications. We try to always deliver with the best shelf life by dealing with direct manufacturers. And when there's a nationwide shortage, HandsomMed is doing their part to find another source. With the patient safety in mind, we're always thinking of what's best for the clinic. The last section to today's webinar is a few frequently asked questions. We offer 4 medical emergency kits. This accommodates all types of clinics. The deluxe kit contains all medications for clinics treating both pediatric and adult patients. The standard kit contains all the medications for clinics treating primarily adults. The main difference between the standard and the deluxe is that the standard kit has only one EpiPen instead of both adult and pediatric. The basic kit holds all medications except for either EpiPens. This is a kit for clinics that may already have EpiPens. Don't worry, each kit contains another source of epinephrine, but the EpiPens make this injection much easier. The upgrade kit is meant for clinics that have their own medications, but like the idea of tracking, monitoring, and replenishing. This kit will upgrade clinics from their own do-it-yourself kit to our service. As mentioned, we offer 4 kits, which accommodates all types of clinics. Automatic replenishment is automatically installed upon purchase. On automatic replenishment, the cost of the medication and shipment is in the delivery box, and customers are expected to pay with each shipment. This may not be the best payment solution for all clinics, so we came up with another plan called annual subscription. The annual subscription is the exact same idea as automatic replenishment, except instead of paying per medication per shipment, the customer only pays once a year. Any medication that expires within that year will be treated the same. We will track, monitor, and replenish, but there will be no fee because it was covered at the beginning of the subscription. The customer must state that they want to be on subscription instead of automatic replenishment, so we can track accordingly. HensaMed offers an online training webinar with each of our medical emergency kits. Here's a clip of what to expect.
Medical emergencies can happen and do occur in the dental office. Welcome to Medical Emergencies in the Dental Office. This course will cover how to prepare for an in-office emergency. There are 4 main categories that describe possible diagnoses: altered consciousness, respiratory distress, drug-related emergencies, and lastly, chest pain. Saving a life requires the implementation of a few simple steps: position, circulation, airway, and breathing. There are 8 drugs in the bare bones basic emergency drug kit, 2 injectable and 6 non-injectable drugs. This kit contains all of the drugs except for oxygen and several secondary items. The moment you think, the moment you feel that you need help, do not hesitate to seek help.
Lighthouse Medical Emergency kits can be purchased through HensaMed Limited directly. We sell only to dental professionals, so if you're not a dental professional, ask your dentist if they're equipped with Lighthouse by HensaMed. We hope you've enjoyed and learned something new. Check in soon for more educational BioBriefs brought to you by HensaMed Limited.